Committee. Thank you for the opportunity to testify with you today in strong support of House Bill 5044 and its act establishing Connecticut vaccine standards. I want to specify first that the overarching goal of this bill is to maintain the status quo for access to vaccines in the state. We have seen several changes in vaccine recommendations coming from the Advisory Committee on Immunizations Practices, which is a committee through the CDC, that have not been driven by new science or peer-reviewed research. Changes to these recommendations have the ability to change vaccine access, choice, purchasing power, insurance coverage, pharmaceutical administration at the state level. Passing this law will allow us to maintain our current access and purchasing power. I want to be very clear that this bill in no way institutes any new vaccine mandates for children or adults, and all residents will maintain their current choice on whether or not to get a vaccine for themselves or their children. So I do want to summarize a bit about what this bill does do. And the origin of this bill was related to changes that came from the Advisory Committee in Immunizations Practices. The first thing the bill does is allow the Commissioner of the Department of Public Health to set a standard of vaccines that are recommended for children, which has been the way it has been, expands that authority to adults. Again, just a recommendation, no mandates. The Commissioner currently must consider recommendations from the ACIP, the American Academy of Pediatrics, and the American Academy of Family Physicians. We have expanded this to also include the American Academy of Obstetrics and Gynecology, and this list is not exclusive. Others can be advised as well. The second thing that this bill does is it allows us to order, administer, and pay for vaccines. Right now, we can only purchase and pay for vaccines that are recommended by the ACIP. The law change would allow us to purchase and pay for vaccines based on the standard of care that I just described that would be established by the department. So it would not be dependent only on what ACIP allows. Current law dictates that we can only purchase vaccines through the CDC. CDC contracts only allow vaccines to be purchased that are recommended by ACIP. If a vaccine is included in the state standard of care that is no longer included in the ACIP recommendations, we would not be able to purchase this vaccine for any child in the state of Connecticut. This bill allows us to purchase vaccines through other procurement mechanisms.